Hey, listen up. Have you ever gotten a MyChart notification and the first thing you do is open it up and see what the results are? And then you start reading about it and you're like, oh my god, I'm dying. And then your doctor's not getting back to you, like what the heck? And then you call them and send a message, you're like, oh my god. Step 1, do not freak out. I'm going to do this mini-series where I go over some of the basic blood test types that your doctor may order and go over what these things actually mean. Alright, so let's talk about the cholesterol panel or lipid panel. We got the total cholesterol, triglycerides, HDL or high density lipids, calculated LDL or low density lipids, and then some ratios down here. In the total, obviously, it includes the LDL or HDL, LDL, and also like the VLDLs and all these other things that aren't on the normal lipid panel. For cholesterol, anything less than 200 we're okay with. Even 200s we're still usually okay with. We use other calculators to see how high of a risk patients are at. But if this number is over 300, typically we will recommend starting cholesterol-lowering medications like statins. For HDL, this does vary between females and males, but in general, 40 is the number. Usually, there's not really a good way of increasing HDL except for exercise and improved diet. Calculate LDL less than 100 for just average person. However, if someone has had a history of heart attacks or strokes and things like that, less than 70 is the goal. Triglyceride does fluctuate more based off your diet, so this number, we like it less than 150, but usually we're not too worried about things like pancreatitis, which is a possible complication of too high of cholesterol until this approaches 500 or above. And lastly, these ratios, we don't really use these much anymore. We use better calculators for patients' risks. Which brings me to this chart, primary prevention ASCVD risk score. So all these things are going through our heads when we see these numbers, so yeah. Long story short, if you do have abnormal cholesterol panel, there's nothing really to freak out about. Just follow up with your clinician. Alright, I hope you found that helpful. I will be going over some other blood work as well. If there are any specific blood work and or other tests that you would like me to kind of give a general educational about, please let me know. Leave it in the comments. This is not meant to be official medical advice, so if there are any specific medical questions, please ask your primary care provider. Bye!